Hello, everyone. Thank you for the invitation to participate in this conference. I do believe that as we talk about real world data, the mechanisms of obtaining information from the patient community are extremely important because the patient-oriented healthcare system model, in our view, should be developed further in Russia. With your permission, I would like to start with the general information. I often cite the adages of the World Health Organization because, well, we all respect this organization, and it was thanks to the WHO we started to talk about a patient-oriented healthcare system because success in medicine depends on this model. There are more and more patients with chronic diseases. In the past, patients just died from chronic diseases, and the medicine is aimed at preserving the life of such patients. The patient can live with this disease for a long time, and well, this disease and the patient go hand in hand. The role of the patient increases here because the patient becomes a connoisseur, and the patient starts playing an important role in the process of treatment, in developing relations with the doctor. There are strict criteria of the patient-oriented model, and I'm not going to go into detail here. In 2006, there was a congress on this subject. I think that, of course, it is important to talk about the relations doctor-patient on the equality principle. The patient and the doctor should be equal in this process. The patient should be involved in the process of treatment. That's important because sometimes, well, we misinterpret this concept. The healthcare system must be more transparent, and Timothy mentioned this in the previous presentation. Real world data give us an important argument in decision making, and we are for transparency here. That's also an element of the patient-oriented healthcare. Another important question is improving the knowledge and skills of medical staff in the field of communication with patients. And here we'll have to go a long path because often there are conflicts because healthcare workers, not just doctors, but healthcare workers in general, do not have enough communication skills, allowing them to maintain a normal process of communication with patients. To improve the level of information and compliance to treatment among patients. Patients have changed. Patients come to see a doctor with specific knowledge, sometimes wrong knowledge, sometimes not, but patients can get the information on the internet. And of course, we should improve the level of information of such patients. Patients should have access to reliable information first and foremost, because patients also Google the results of clinical trials. They monitor the results of clinical trials that are underway. These results are in public domain. And another question is that there is a group of drugs when there are no data. For example, I'm talking about orphan diseases when the government has to make a decision regarding the high price of such drugs and their reimbursement, and there is not enough data of clinical trials, and of course, we're talking about the individual approaches here in the decision-making process. Well, going back to the patient-physician relations, they should be based on trust. The doctor should have should trust the patient and vice versa. It's a two-way process. Well, the questions of respect, it's also a two-way process. Compliance is number three, and efficacy or effectiveness of treatment. We believe that the patient-oriented model is the way to improve the healthcare system efficacy per se. And of course, patient organizations are like trade unions in the industry. We have our voice, we have our motivation. We want the dialogue to be constructive because we understand that without having a dialogue with authorities, it's impossible to solve all the problems. Of course, we have the feedback. We provide feedback through patient organizations. There are more and more patient organizations in Russia. Well, you can see some statistics here. Well, and you can see that not all organizations came into light. And of course, the patient organizations are the serious source of data analysis. Well, you can see this pie-shaped chart, and we are talking about the organization of medical care first and foremost, the triage of patients, well, the timelines for providing care, providing information for patients, and so on and so forth. So you can see that this is a very important aspect. Well, drug procurement is another important aspect here. I think that in the near future, we won't see any drastic changes here. We do have a lot of problems with drug procurement. And number three, that's the subjective view of patients. And number three is the question of quality of medical care. So organization of medical care is number one, drug procurement is number two. And you can see that we poll patients, we have two major cohorts. The patients per se, their voice should be heard when trials are conducted. And the second cohort, well, are activists, the leaders of patient organizations, because they see the entire picture from a different angle. They know the systemic problems of healthcare or in a particular field. Well, they can sum up all the complaints by looking at them from a different angle, by looking at the situation on the basis of their own knowledge. And if we're talking about a patient-oriented system, first of all, we should take into account the patient's needs. We should not make a decision for the patient. We should hear out the patient, what problems are important for the patient. That's important to make the system better, to forecast such changes, to make a prognosis regarding the patient's opinion of the healthcare system, to inform the patient. Well, of course, triage and the patient journey play a very important aspect. And of course, when we're talking about different problems, we should say that in Moscow, decisions can be made and the situation improves, but in the regions, well, the patient journey cannot be quite specific after the diagnosis is made. Another important aspect is the replacement of in-hospital technologies. Medical care should be provided as close to the patient as possible. Often there is no need to hospitalize a patient, and here, of course, bringing care to the patient is an important aspect of the decision-making process. Feedback from the patient, I have already mentioned it, and also personnel training so that medical staff and other healthcare workers could have a different culture that's also part of the patient-oriented system. Well, doctors should be included here, medical organizations, well, issues related to information systems, patient organizations, pharmacies. Often, sometimes we forget about families. Family members should also be involved in the system. They are our allies. They are doctors' allies, must be doctors' allies. They must help the healthcare system because most part of the treatment is being conducted at home nowadays. Well, we mentioned different figures today, and of course, figures should be the drivers of patient-oriented models. And of course, digitalization of the healthcare system is another important aspect. And here you can see some of the aspects. Here, number one is clinical registers. Sometimes the situation with registers is very poor. We do not know how registers are going to be developed. We have a serious gap here. Of course, pharmaceutical companies should not maintain registers on their own. Well, because in this case, registers will appear and then disappear. That's wrong. Well, of course, registers should not just depend on the budgets of the pharmaceutical companies. They can have a register at the initial stage, and then the register is gone. The government should be involved here because registers are the source of data, a serious source of data regarding the efficacy of treatment, and the government must allocate hundreds of billions of rubles to have such registers. And in conclusion, I would like to say that from general discussion of the patient-oriented model in healthcare, we must develop a legal structure to come up with legal terms, well, and principles, and implement such principles in real life in Russia. Thank you very much